Hey everybody, Amy Abelar, acupuncture business coach, and today I'm going to talk a little bit about how to dose Chinese medicine and the importance of accurately dosing Chinese medicine for your patients so that they can have success and that they can be coming back into your doors. So number one thing I want to say is ethical decisions first, right? You do not want to overprescribe Chinese medicine, telling patients they need to come in 4 times a week if that is not true, right? So I'm not talking about ways to get patients to come in more frequently than what they should, but I also want to touch on something else, which is that it's also unethical to underprescribe Chinese medicine. And there's a few reasons for that. Your patient came in with a concern that they would like to be addressed. If you know that they're going to need treatment once a week, then that's what you should be recommending. It doesn't matter if you are feeling like you're not sure if they're willing to commit to that. It doesn't matter if you're feeling like, well, I don't know, that seems like a lot of money and maybe I need to build a package, maybe I need to discount it, maybe, we'll talk about cost and how to set your pricing and things like that in other videos. But the number one thing that I want to make sure we touch on here is you do a disservice to Chinese medicine as a whole, as well as your patients, as well as your practice when you underprescribe Chinese medicine. So let's say, for example, you have a patient who has multiple things going on fertility-wise, right? Their luteal phase is too short. They don't have enough cervical mucus. They don't have enough fertile cervical mucus. They don't have enough menstrual blood. They're super blood deficient, major chi stagnation. They have lots and lots of things that are interrupting their ability to be able to conceive, right? That patient should be coming in once a week. They are going to get a different treatment at the beginning of the cycle versus when they're in their luteal phase, because there are different things that you need to work on. Explaining to your patient, hey, this is what's going on in your cycle. These are some of the things that I see inhibiting your fertility right now. There are going to be different treatments that I want to do for you depending on where you're at in your cycle. And it's really important that you come once a week so that we can make sure that we're effectively getting your menstrual cycle to be more optimal for you to be able to conceive. None of what I just said is false. All of that is good information. All of that is helpful. You're giving this patient answers of things that you can see from a Chinese medicine perspective for why you need to be treating her once a week. I've had patients who have then responded with, absolutely, I'm happy to get on the schedule once a week because that's what they want. And they have their goal of becoming pregnant, right? I've also had patients who have then said, I don't think that I can afford to come in, every single week. What if I come every other week, or I come every 3 weeks, or I just come once a month? And I'll tell them, you can absolutely still come in once a month or once every 2 to 3 weeks if that's what you want to do, or that's what you feel like you can afford to do right now. But I can tell you that, again, because there are different treatments that we can do at different points in your cycle to help get you into a more optimal fertile cycle, you're not going to be able to get as great of results if you're not coming in as frequently. And so just being super upfront with your patients about this, right? I have providers that I know who will say, if they're not going to come at the frequency that I recommend, then I won't treat them because I know that they won't get, as good of results. I don't think that's necessarily a great plan either. Everybody to each their own, right? But I personally feel like as long as I have ethically disclosed the treatment recommendation that I think will be the best thing for them, and I've done that with my Chinese medicine knowledge ethically, then if they're not able to come in as frequently and you've also disclosed to them that means they may not be getting the same shifts and the same results as quickly as they would like, then, that you've done your job as far as I'm concerned of ethical prescribing of Chinese medicine, and again, disclosing what you feel like they need in order for them to get the best results. Also, overprescribing Chinese medicine. This can appear to clients differently. So you could have an overprescription where, again, you're telling patients they need 4 times a week when they really don't. That's not going to be a good thing to do. Ethics is always top priority. But one of the other things is, let's just take 10 to 12 treatments. One of the top things I always start out with for patients, because this is easy for them to commit to, easy for most people, I should say, to commit to, is I will tell patients you should come once a week for the first 3 weeks. After that, we'll see how your body's responding. I let them know that if they only did 3 treatments, doing those first 3 treatments closer together at that once a week interval will get them more results for the same amount of money than if they took those 3 treatments and they did it like once a month. That really coming in the beginning closer together is hugely, hugely important. And so I will let them know that. One of the things this does is it lets people know that you're trying to help them get the most bang for their buck. Like, again, you spend the same amount of money, but you come too far apart, you're not going to get the same results as if you would have come close together for the same cost, right? So I'm on their side. I want to get them the most bang for their buck. I also don't want to overcommit them, right? They may end up coming in for 10 to 12 treatments. What I'll usually say is that at that point, because sometimes patients need more treatments, sometimes patients need less treatments. I have had things, right? We're told in school, a chronic condition is going to take a long time to heal, more treatments, a longer recovery time, and acute things take less treatments and a shorter recovery time. I've seen in my practice time and time again, depending on what it is that I'm treating, I've seen chronic things resolve pretty quickly, and I have seen things that are pretty acute take a long time to recover. And so, don't be using those things as the foundational be all when you're recommending things to patients. Telling them once a week for 3 weeks, easy for them to bite off, easy for them to say, okay, yeah, I want to do that. I'll also tell them what to expect over those 3 weeks. I'll say that on a rare occasion, sometimes people don't feel a whole lot of relief from their first treatment, but they feel more relief than from their second and their third treatment. But that most commonly what happens is you get some relief from your first treatment, you'll feel even more relief for longer from your second treatment, and you'll feel even more relief for longer from your third treatment. And then once you've had those 3 treatments and we can kind of see how your body's progressing, then I will be able to make a better recommendation for you based on your body and how your body is making the changes and the improvements. Then we can see, should we continue with once a week for a little bit? Should we start spacing it out? And it really just depends on what it is that people are working on. So again, being ethical in how you make your recommendation. You don't want to overprescribe. You don't want to overprescribe for unethical reasons, but you also don't want to say, hey, you need 10 to 12 treatments. Even if you know that that may be the case, you can say, hey, I think we should start with once a week for 3 weeks. I know this is going to be a beneficial frequency. And at that point, we can see how your body has responded and then make another recommendation from there. But commonly, this is what I see in my practice. And then you tell them what you frequently see. I can tell people that frequently I may say, you know what, you're making great progress after these 3 treatments. Let's go to every other week. And they're like, you know what? I actually want to stick with once a week for a little bit because I'm so excited that I'm feeling better that I don't want to lose any traction. And so I would like to continue to come once a week for the next couple of weeks, if that's okay. Yeah, absolutely. You can do that. Absolutely. You'll get more results faster. But working with patients and again, making your recommendation with the knowledge that you have and trying to take the most ethical approach that you can is always going to be the best strategy. But again, if you're not confident in the medicine and you are feeling like, oh, well, I don't know, maybe I should tell them they might not need more treatments. And what if they do need more than one? And, do you know anything for the most part that takes one treatment and is just bam, resolved? Like not even cortisone shots work like that. Not even surgery works like that. Not physical therapy, not medication, not anything. So patients are going to need a little bit more than one treatment frequently. They might feel better symptomatically after that first treatment, right? You might be able to treat that branch symptom. But if you really want to get down to the root of things, you're going to need more than one treatment. And that's okay. That's normal, right? As a massage therapist, I used to have patients who would come in and they'd get a 60-minute deep tissue. They'd want to just focus on their back. They're people who work at a desk for a long period of time, right? They've worked at a desk for 20 years. And they come out of their 1 hour massage and they're like, well, yeah, I still feel like there's a little bit of tightness there. I feel a lot better, but I still feel a little tightness. Well, of course you feel a little tightness. You haven't been getting massages, and you did a 60-minute massage, and you've been working at a computer for the last 20 years, right? So again, like be realistic. Know that there's going to be some flexibility in there. Be honest with your patients about what you're trying to do. Show them that you're trying to be ethical in your approach, that you don't want to tell them they need more treatments than they do, but you do at least know that the first few treatments close together are going to make more of an impact on each other than if they were too far apart. And we know that to be true. So asking them for a low commitment, knowing that after that, there will probably be some more treatments. It just depends on the person, but not trying to get them to sign up for some major package, some major, I know for a lot of acupuncturists, that feels very icky to them to take money from people when you haven't given the service yet, or to try to sell someone a long-term package when, you don't know if that's really what they're going to need for the specific thing that you're treating. And so, again, I would just advise you all to do things as ethically as you can. But again, sometimes because we're not feeling confident in our medicine or in our approach, or we feel weird asking people for money, we can also underprescribe acupuncture or herbs. And that can be equally unethical, to not give that person the best recommendation that based on your knowledge of Chinese medicine, that would be helpful for them. So again, don't be afraid to tell them what you think that they need. Ask them for an initial commitment that is something smaller, that then they can work on seeing those results. And I guarantee you, when people start to feel better with those first few treatments, they're going to be like, yep, now that I'm aware that this medicine works, I'm feeling better, and I don't feel like this person was trying to take advantage of me. I want to come back for more treatments because I like the results that I'm seeing, and I like that this person presented it to me in a way that wasn't trying to take advantage. So work on your confidence, guys. Work on being able to ethically communicate, not overprescribe, not underprescribe. And I guarantee you those ethics will shine through. Patients will be thankful for that. And I think you'll be seeing a lot more patients in your office at a more frequent interval. Okay?